Στη συνέχεια θα καλέσω στο βήμα τον πολύ καλό μας φίλο, τον διευθυντή του κέντρου ελαιολάδου του Πανεπιστημίου της Καλιφόρνιας στο Davis, τον κύριο Flynn.
Thank you. In January, we were honored that the International Olive Council chose UC Davis and the Robert Mondavi Institute to hold a conference on the health benefits of olive oil in the Mediterranean diet. And I think that the IOC was looking to determine whether there's an international consensus on these benefits. So they gathered some of the eminent scientists on both sides of the Atlantic to come to the campus and to present the evidence about the benefits of the diet. And at the end of the conference, I had the sense that the work that these researchers were doing was heroic. And heroic is not really a term that you would use to apply to researchers generally. You would maybe call the firefighters heroic, but not someone that does research. But when you think about the definition of a hero as someone that protects others from harm, I think it applies to the research that's going on in this field. And so I'd like to just cover three main areas that emerged from this conference for you today. So the first point that came through loud and clear was that many of us are facing danger in the food that we eat and the impact it is having on our health. And this was a slide that was shown that just illustrates the growth in obesity worldwide. And this isn't just an issue in the affluent countries, it's an issue that's growing everywhere in the world. And when you look at the impact that obesity or just being overweight, in this chart here that's looking at the body mass index, and the numbers of deaths that you get with cardiovascular disease, with cancer, with chronic kidney disease and diabetes, you can see that this link between obesity and being overweight has a very strong impact on disease and longevity. Another area that was covered was this global epidemic of type 2 diabetes. And you can see in this map of the world where the hotspots are in terms of total numbers. The United States and India and China, more than 20 million people have this disease, but it's growing worldwide. And even in those areas in blue, there's anywhere from 1 to 10 million people that are suffering from this disease. And you can see that in this slide, and I took these slides primarily from what was presented at the conference, that the major driving factors are overweight, obesity, sedentary lifestyle, and the increased consumption of unhealthy diets. So, obviously, the Mediterranean diet is an alternative to this grim picture, and we've heard a little bit about the benefits that Stefanos had talked to us about, and we're all familiar with this graphic, which has been refined over the years, and that we should, at the bottom, not only into what we're eating, but our lifestyle, we should involve exercise and conviviality and get adequate rest. And then, of course, we want to focus on whole grains and not the carbohydrates that give us quick digestion and have bad effects on our health. And of course, avoiding red meat, minimizing sweets, and so forth. This work has been going on since the 1950s. Even though the knowledge of the Mediterranean diet has been known for thousands of years, it's only been since about the 1950s that modern science has been documenting how healthy this diet is. As Walter Willett from Harvard, one of Stefanos' colleagues, had mentioned at his conference, this is the most well-documented diet in the world for its impact on our health and longevity. So, the second thing that I would like to talk about that came out of this conference was that these benefits are very well documented. And this is a slide that Professor Willett included in the program, and it's showing some work by Ansel Keys, who was the one who developed the terminology Mediterranean diet back in the 1950s, and who did pioneering work in this field that all of us are building upon. And in this graph, you can see that on the bottom, you can see that the percentage of dietary calories from fat, and then on the left, the 10-year coronary incident from all causes per 10,000 men. And over the top right, you see that East Finland, which the population really relied on a highly saturated fat diet based on reindeer meat, had a very high coronary incidence, the highest in the area studied. Whereas you look at Crete, which also has a high-fat diet of around 40% when this work was done, but a much lower incidence of coronary heart disease. And so this was the pioneering, some of the pioneering work that helped lead us to additional studies to determine how healthy this diet is for us and how it increases longevity. And we've heard mentioned the PREDIMED study, which was done in Spain. It had a focus on a high-risk population that had 3 or more risk factors. They were an older population of men and women between the ages of 55 and 80. And this study had 3 different groups of people. One was the control, one was fed a Mediterranean diet with nuts, and one was fed a Mediterranean diet with extra virgin olive oil. And the impact was so dramatic on reducing heart attack, stroke, and cardiovascular death, reducing it by 30%, that they cut short the extension of this study to the full 6 years because the results were so dramatic and they felt compelled to get the information out sooner than the 6-year duration of the study. So the PREDIMED study is highly important that was done and released in 2013, and the work is continuing. It also looked at the impact of the Mediterranean diet with nuts and the extra virgin olive oil on diabetes, and again, found quite dramatic results in both the nuts and the extra virgin olive oil with the Mediterranean diet on reducing the incidence of diabetes. Then there was a whole lot of slides shown at this conference that looked at cohort studies and meta-analysis where they looked at groups of studies together to see the impact of the Mediterranean diet. And just in simple terms, the vertical solid line there would be the no impact point. Anything left of that vertical line would show there was a beneficial impact of the Mediterranean diet for cardiovascular disease. And here you see that of all these studies, there was a consistent showing of benefit. We also saw that in meta-analysis of studies that were looking at colorectal cancer. Same idea, the vertical line, you see a number of those studies are to the left. And on prostate cancer, you can see that those studies are to the left. Even on depression and its impact on our mental health, the Mediterranean diet has a beneficial impact across a number of studies. And then the third thing that came forth to me in this day-long event was that the more you adhere to the Mediterranean diet, the more you'll get benefits. And these studies would look at various adherence rates for the Mediterranean diet from 0 to 9. But here's an example of its impact on Alzheimer's. And Magda had reviewed this issue in some depth, but you can see there's 3 levels of adherence to the diet here. The heavy dark line at the top is the highest adherence, and then there's the medium and below that, the light gray line. And you can see that the cumulative survival rate over a period of years is highest for Alzheimer's, for those that adhere the most to the Mediterranean diet. Similar impact you can see in this chart here on heart attack. You know, the highest adherence the lower you'll have an incidence. And then in this chart, there was an example of the more extra virgin olive oil that you consume post-study as far as breast cancer risk goes, the lower your risk, the more olive oil that you consume. Harkening back to that early study by Ansel Keys with what he found in Crete as far as the coronary heart disease rates of men in Crete. So, one of our presenters, Dr. Frank Hugh from Harvard, had summarized a lot of the information just in this one slide here. And the bottom line is that the Mediterranean diet is going to give you a lot of benefits. You're going to live longer, you're going to decrease your risk of a number of chronic diseases, and you're going to prevent cardiovascular mortality, cancer mortality, and the incidence of cardiovascular disease. And so we saw a day of this type of information over at UC Davis, along with our partner, the Robert Mondavi Institute for Wine and Food Science. And at the dinner that we had afterwards, we had all the professors and scientists around the table, and we were having dinner, and during the dinner, I asked them, I said, well, what is the bottom line here? I mean, we saw all this data. How many tablespoons a day do you recommend that people consume to maximize their health benefits from extra virgin olive oil? And the consensus around the table was 3 to 4 tablespoons per day. And I looked at the statistics that the International Olive Council has on olive oil consumption in the world. And there's no country in the world that is at this level. Italy comes somewhat close at almost 3 tablespoons. Greece at one time was at almost 4 tablespoons, but it's declined in recent years. But if we can get the consumer to start thinking in terms of more extra virgin olive oil in their diet, along the lines that we've heard from Stefanos and Magda in the research that they've done, then people would live longer, they would feel better, there would be less disease, and the olive oil producers would enjoy more prosperity. And if we could achieve that, I think the word I would use to describe that would be heroic. Thank you.